Okay, axial skeleton extremity. So where does it go from and to? What's the name of this bone? Sternum. Goes from your sternum to your scapula, right? So it's acting as a strut between those two things. You can totally dislocate it, rupture all the ligaments between it, and what happens? Stays pretty well, right? So it couldn't be that important. So we should just take everyone's clavicle out rather than operating on it and try to fix it. So it is interesting though. I mean, there's a ton of muscular stabilizers in there too. So, so the clavicle is acting basically as a strut between your scapula and your sternum, right? What type of joint is the glenohumeral joint? It's a ball and socket, right? So, and how is it different from the rest of the other joints in the body, or why is it different?
It's not very deep.
The socket's not very deep, right? Okay, so it's more like ball and socket, right? Golf ball on a golf tee. Okay, so it's very flat. I like to almost think of it like a beach ball on a table, right? So it's just this. If you just had you don't have anything surrounding it, you get this big beach ball on the rolling around on the table. It's got a lot of motion, and that's the reason it's got a lot of motion is because it's very free to move on there. So sitting on top of that table, you've got something that rests on top of that table to kind of help support that beach ball. What is that? A labrum. So labrum goes how many degrees around the glenoid? What? 360, right? Yeah. So it goes 360, it goes all the way around. So you got this labrum that goes all the way around. It's like an inner tube sitting on that table and the golf ball sitting on top of the inner tube. Okay. That's if you're doing shoulder scopes in a lateral position. We do them in beach chair position. Gloria, how do you do your shoulder scopes? Beach chair or lateral?
I do beach chair for most things, unless I'm doing a posterior labral repair, remplissage, really low anterior labral tears. So, but cuffs and I was trained in beach chair and I love it, but I'll do laterals when I need to. And Eric, this is awesome, but I have to leave. I'm sorry. Don't be insulted. It's not
Oh
you.
God.
I gotta get my kid to school.
Now I was nervous and now
Nope.
I'm insulted.
You're awesome. You
Okay.
guys are lucky to be trained by him. So enjoy.
Thanks, Gloria. Talk to you later.
Sorry. Bye.
So labrum we know goes all the way around. Okay, it's like that inner tube sitting on the table. It goes all the way around the table. What ligaments are associated with the labrum? Glenohumeral ligaments was the correct answer. And how many of them are there? What are the I'm getting a 5, getting a
Superior, middle, inferior.
right. So there's a bunch of bands to it, but primarily we think of superior, middle, and inferior glenohumeral ligaments. And those glenohumeral ligaments are basically like thickenings in the capsule, maybe a little bit more than thickenings in the capsule. They wrap all the way around the humerus and basically are part of the capsule and come back up to the posterior. So there's an anterior, an anterior and a posterior portion of all three of those ligaments, right? And they're just basically wrapping around. And various different portions of that ligament are tight in different positions. When you're abducted, your inferior glenohumeral ligament is tightening. When you're externally rotating, and it just depends on the position that you're in. And you can imagine for a joint that's that tight but needs to have a lot of range of motion, you have to have ligaments that are doing different functions, because if you've got one ligament that's performing the entire function, it's only going to allow motion in one plane. So the other two ligaments really need to be loose while one ligament is tight. Does that make sense? You ever think of it that way? Okay. Your glenohumeral ligaments are like the, your humeral head is like a dog, and those glenohumeral ligaments are like a leash. And you only have one leash at a time that's going to be tight to rein in that dog, depending on the position where he's at. If that dog's up in the air, meaning abducted, then you've got your inferior glenohumeral ligament, that leash, which is tighter. If he's down lower, it's a superior glenohumeral ligament that's going to be tighter, right? Make sense? So you've got to have, that's the reason it's like that. It's a great design, much more complicated and sophisticated than the knee. All right. Let's do a few other things. Neurovascular anatomy. Start with the easy ones, okay? What are the primary vascular structures crossing the shoulder joint? Have you got one?
Yeah, axillary.
No, vascular structures. Okay, circumflex humeral arteries, but that's not really crossing the shoulder joint, right? So what is it that's crossing the shoulder joint? Radial artery. There's the radial artery. Guess where's your radial artery? Point to your wrist. Yeah, radial artery is a branch of a big artery, right? So what is it up here in your shoulder? Subclavian becomes your right. Well, how about axillary? Brachial, right? Okay. So that's the big guy. And that runs after it crosses here, across here. Where's it go? I'm sorry if you can't see this, but you should be pointing at your shoulder, sort of under your clavicle, right? And then, yeah, exactly. It kind of goes down into here. You can feel your pulse almost just anterior to your armpit, right? In that little gap right there, you can feel your pulse. Okay. And then you've got these other branches of that artery, which are coming off the anterior and posterior humeral circumflex arteries, right? Okay. How about a little bit tougher one? This is not tough. What are the nerves that cross the shoulder? Axillary, we're gonna name, okay. Big nerves. I don't want little ones. I just want the big ones. Musculocutaneous nerve, axillary nerve. Nerves that go across the shoulder joint. Radial goes across the shoulder joint, right? These are all branches from what? Brachial plexus is all branches off your great brachial plexus. Musculocutaneous, axillary, radial. What other nerves are crossing the shoulder joint? Don't want to say. What are they? Ulnar nerve, does that cross the shoulder joint? Yes, it's got to go from your neck to your hand. It's got to go across the shoulder joint. One more. Median nerve, right? So those are the big guys that are crossing your shoulder joint. It's all the big nerves. Okay. So now let's trace them out. Where are they? So this is another one that's better for everyone in the room, not as good for everyone on virtual. But let's trace them out. Where's your musculocutaneous nerve? Well, where do they all start? Let's point to where all these nerves are starting. Big picture. Neck, right? So I'll point starting up in your neck. And then where are they going? Oh God. Now I'm on screen. Now they can see me. I got new shoes.
Yeah, it should be in this.
Okay. So they're all starting in your neck, right? And then they're coming where? Down under your clavicle, right? Are they going over your clavicle or under it? Under it, right? You want to put all these important things under there, and that's brachial plexus, right? And then they're joining what vessel under there? Big one. Subclavian. They're kind of all wrapped around the subclavian, okay? And then they're going across here, okay? And then they're starting to branch, okay? And we're going to start off with, let's start off with axillary nerve. Where is it going from here? Yeah, it goes around into your armpit right here, right? And then where does it go? That's around, and it's kind of way up deep in there. And then where's it going? Goes around here, right? Is it high up here or is it low down there? What is it? What's the most distal muscle in the back that it innervates? In the posterior, yeah. What's the most distal one that it innervates? Deltoid is more distal for sure, but there's another muscle that's back here that it innervates. No, it's one of your cuff muscles. Teres minor. So it couldn't be that distal, right? It's got to be up pretty high. So it's not really going down and around like this. Okay, so it's actually stays up pretty high. So it's through your axilla, right underneath the glenoid, and then coming back up and going across right across in here. Okay. How about, so that's axillary. Let's do musculocutaneous nerve. Where's that? Where's that going? You know where it starts, right? So we know it starts here. Okay, where's it going from there? It goes, where is it relative to the coracoid? That's a good landmark. Does it go above the coracoid or distal? Distal the coracoid. How far distal?
Too far.
It's not very far, right? It's pretty close to the coracoid.
Yeah.
And then where's it go?
The-
Yep, so it's right in there. Between those two, actually, coracobrachialis and short-headed biceps. And then where's it go? Where does your musculocutaneous nerve go from here? We know we got it to here. What's its most distal function? Sensation. So lateral antebrachiocutaneous nerve of the forearm is down here. Okay, so we know it must get down there somehow. Does it go in the back or in the front? Front. One guess for front. One correct guess for front. Okay, it goes in the front because it's innervating all these muscles, right? It's doing all your biceps muscles. So we know it's got to be running here, and it runs right on top of brachialis. So it runs all the way down here. Okay, and then it branches out and does a lateral LABC. Okay. How about ulnar nerve? Where's it? Where's it start? Okay, right up here. Where's it go? Yeah. Inferior coracoid. Yeah, and then it's just a little posterior. So you got this medial intermuscular septum here, right? So it's getting behind the medial intermuscular septum, whereas brachial or musculocutaneous nerve is staying anterior to the medial intermuscular septum. So that ulnar nerve is just running in the back right there. So that's it. Okay. Median nerve. So it's kind of following a similar track, but is it going anterior to the medial intermuscular septum or posterior to it? Where's it? Posterior. Where's it headed? Yeah, it's staying. It's here, right? So that guy's coming in the front. So median nerve is anterior. Okay, so that gives you a sense for all these big nerves are around the shoulder. Hopefully this is working for you guys. Hopefully I brushed my hair. Can't remember. So there's, oh, this is going to get good. So this is kind of what we just did. We'll skip that because I was late. Muscular anatomy. How many muscles can we name across the shoulder? Origins, insertions, functions, innervation, all of them. What do we got? Start with a few big ones. What are two big muscles across the deltoid, innervated by the axillary nerve? What else? There's four muscles, not really a bundle, right? Four muscles, rotator cuff. Okay, what are they?
Supraspinatus, infraspinatus, subscapularis, and teres.
Okay, innervated by.
Teres minors, the axillary.
Yep.
Super scapulary.
Okay, supraspinatus. What about infraspinatus? Suprascapular nerve, and what about? I'm repeating all the.
I know.
Okay.
But it's just trying to get the
Get in.
up.
If you think you know the answer, say it loudly. And I'll just yell loudly if you get it wrong. Subscapularis, what's that innervated by? Subscapular nerve or nerve subscapularis. Okay. So that's four more. Good. What give me a couple other ones. Biceps. So okay, long head of the biceps. Okay, triceps. How many parts of the triceps? Three parts of the triceps. What about biceps? We're kind of skipping a couple biceps parts. Short head of the biceps and coracobrachialis, right? So we're doing pretty well there. What about more in the front? Pec major, pec minor, right? And I'm being nice to you guys. I'm not making you go over all those origins, insertions, and functions, but you should know most of them. What's innervating all those triceps muscles? Radial nerves in the back, right? What's innervating pec? Yeah. Okay, there's three different nerves innervating the pec, okay? But here's the big ones, guys. So here's pec. So and deltoid.
Click on that.
Yeah.
No, depends.
Oh, I can draw and stuff.
Laser pointer.
I can point at stuff. There we go. There's our pec. There's our deltoid. Here's a lot of stuff we went over, okay? Here's Look at these guys here. What inserts on the coracoid? Pec minor, right? Pec major is inserting somewhere else, but here's all those biceps muscles that we were just talking about. Okay, here's all of our, or two of our cuff muscles. So there's subscap coming in there, supraspinatus coming in there. Here's origin. What muscle originates right here on the clavicle? Deltoid. And what muscles here on the clavicle here? More medial? That's pec, right? So pec is there. What about all this this origin here? It kind of says it. Pec major, right? And it also is also coming off of these ribs. And then pec minor inserts on the coracoid, yeah. Right. Latissimus dorsi, we didn't go over that, right? That's coming from where? The back, right? And what's that function? Primarily like adduction, right? It's got another function too, we'll go over in a second. There's teres major. Teres major is funny, right? Starts in the back, goes to the front. Does it externally rotate, internally rotate? What's it do? It's got to adduct some, right? Because it's starting medial and going lateral. Internal, external rotation. It can be internal rotation, right? As opposed to the two other posterior cuff muscles, which are lying right next to them, which then go and what do? They externally rotate. So these muscles are all starting almost in the same place on the scapula, and they're going up and ending in different places, right? And so their function is of course then different, and it's all about where they lie on that center of rotation of that axial or that round bone, right? Called the humerus bone. So here's musculocutaneous nerve coming down here. Here's these other two nerves that we talked about be going medially. Okay, that's ulnar nerve and median nerve. Musculocutaneous nerve is just distal. Usually, we'll go over some questions on that just in a minute. Is that looking more familiar now? Okay, so here's the venous anatomy, and this guy is really important. What vein is that? It says it right there. So it's cephalic vein. But why is this cephalic vein important for us? Lies in the deltopectoral interval, in the groove between the delt and the pec, which helps guide us to what? Yeah, that's our approach, right? So we look for that vein. We look for that cephalic vein. When we find that vein, we know we're in the right interval. And that's when we go down. That's where we go down. Oh, this is a terrible place to have to hang out. This is where all the real danger stuff comes in. Okay, so here's those vessels that you were talking about, that posterior humeral circumflex artery and vein, right? So, but we're not going over that right now. We're just going over muscles. Triceps, long head of the triceps. Where's the long head of the triceps originate? We'll come back to that. Lateral head of the triceps, and there's a medial head of the triceps too. And here's that teres major and teres minor. You see how one goes around, they're right next to each other. One of them goes around to the back. One of them goes around down below. Okay, and you can see why, here's that axillary nerve that we were talking about. See how close it is to the capsule right here still? So it doesn't go way down, it stays up pretty high, and it actually curves back up to innervate this deltoid, but it runs right past teres minor on the way, so it jumps up, sends branches there. Then infraspinatus and supraspinatus are up top, and you can see that suprascapular nerve coming through the notch and innervating those two guys. That's cool. We're going to go over these triangles and squares in a few minutes. I'm sure you guys know all about those already. All right. We're going to go, just skip right on to, all right. So this, we're going to start, I know that we have very briefly glossed over the shoulder. Okay. But we're going to start, you got to keep me posted on time too. So we're going to start with doing some quiz, and then we're going to talk about what the talk about the questions. So we're going to try to learn from this process. I'm not just trying to, we're not giving you a score. Okay. Insertion of latissimus dorsi lies directly between which two structures? Okay, let's rule these out. Does anyone know the answer to this question? It lies between which other two muscles? Because these are all muscles on our questions, right? Near teres major. Yeah, we saw that, right? We saw that little picture. So insertion of pec minor and pec major. Where's pec minor insert? Coracoid. And pec major. Where's it insert? Where does pec major insert? You can feel your pec major. Take your arm and put it on the side of your chair like this. And push really hard against your chair. Now feel in your armpit. Feel that tendon? That's pec major. Where's it going? Is everyone at home doing this? I hope. Please broadcast it. Where's it headed? Yeah, you're pointing right at it. It goes right over here. Okay, it's going right over to your humerus, your humeral shaft. Okay. So it's probably not between coracoid and pec major, right? So it's probably not number one. Insertion of deltoid and pec major. Deltoid, where is this insertion? It's way down here, right? It's further down than you think, but it's almost mid-humerus. Deltoid and pec major. So does latissimus dorsi get that far anterior? It doesn't, right? Think about it. If it was going to do that, it'd have to cross through pec major, because we know pec major is inserting right there. Origin of brachialis and the insertion of pec major. So that's not a terrible guess, because brachialis originates where? Brachialis muscle. So we have a lot of things that flex our arm. That's why long head of the biceps is not that important. Brachialis just originates on the humeral shaft, on the anterior humeral shaft. Okay, so that's not a terrible guess. Insertion of pec major, insertions of teres major. So pec major we know came around the front like this, and teres major we know came around from the back like that, and we know that latissimus dorsi is right in that area. Okay. So that's where it is. It's right in between those two. So there it is. Here's teres major right there. And here's latissimus right there. And then pec is coming across here. Okay. Latissimus dorsi, a lady between two majors. Okay. So I like that because it's fun to try to understand how complicated those muscles are interweaving and interdigitating right in through as they're coming from the back to the front, basically underneath the armpit. But they're getting all the way to the front. Oh, here we go. This is where it gets good. Triangular interval. You guys know about the triangular interval? Oh, Camille just got a really bitter beer face. All right. What three structures and what structure runs through the triangular interval? You guys know the answer to this question? Yes? Okay. If not, we can skip forward and go to and learn from it. But if you think you know it, let's hear it. So laterally, what is it formed by? What is the border of the triangular interval? Lateral border. No ideas? No? Mm. So this is where we're talking about right here, okay? So some people will say the lateral head of the triceps is sort of that lateral border. Okay. Some people say it's humeral shaft, it's a lateral border. Okay. And the triangular intervals, you're almost just peeking through the triangular interval. It's not really like there's not stuff coming through that. You're looking through that because stuff is going behind it. Okay, so you get long head of the triceps for sure. Okay. Teres major is that superior border. Okay. There it is right there. And then lateral head of the triceps here, or humeral shaft right there. Okay. So you know the next question is going to be about the quadrangular space. So let's just stay here on the quadrangular space. So quadrangular space is actually a space where things are coming through the quadrangular space, okay? So the lateral border of a quadrangular space is going to be what? Humeral shaft again, right? And then long head of the triceps is going to be that medial border. Teres major is going to be its inferior border. And the superior border is teres minor. And what's coming through that space, that quadrangular space? Axillary nerve and vascular structures. We don't get to say vascular structures anymore. That's what you say in ATC school. Vascular structures. What are they? You know this one. Posterior circumflex humeral artery, right? That's it right there. Okay, so that's that space. Got it? So we know laterally shaft of the humerus or lateral triceps, medially long head of the triceps, superiorly teres major, and the structure that you see through there is radial nerve. If you think about the quadrangular space and the triangular interval, there's actually a lot of similar sort of landmarks, right? They should both share teres major. They both share a humeral head. They both share a long head of the triceps as far as their borders. And then either the lateral head of the triceps or humeral shaft is that lateral border. This is a good one. You guys should know this. Internervous plane for the anterior approach to the shoulder lies between which two nerves? Which two muscles, but which two nerves? So what are the two muscles? Deltoid and pec, okay. Deltoid is innervated by axillary nerve, so we can rule out anything that doesn't have axillary nerve on there. So that gets rid of this one. Axillary nerve and subscapular nerve? No. Axillary nerve, medial and lateral pectoral nerves? Okay. Or axillary nerve and lateral pectoral nerve? So what is pec major is innervated by? It's major. Big, right? Yeah, it's got both those nerves. All right. It's a little bit of a trick question though, because maybe it is just branches from the lateral pectoral nerve that are innervating the lateral portion of that muscle. I didn't make these questions up, by the way. I just made up the answers. Okay. Muscles which take their origin on the coracoid are innervated by what nerve? Okay, so what are the two muscles that take their origin off the coracoid? Oh, that was correct.
It was a short-
Short head of the biceps, and then your favorite muscle, which you've said about 3 times in this talk,
Coracobrachial.
coracobrachialis, right? Coracobrachialis and short head of the biceps. Coracobrachialis is not much of a muscle. I don't think I've ever seen coracobrachialis. Have you ever seen coracobrachialis? I don't think so. I think it's just something we made up. It's not a big thing. It's a vestigial muscle that's part of that. I think I really don't think it exists. Okay, but that's gonna be an easy one, right? Because we know that those two muscles. We saw the picture where that coracoid is cut right there, and then here's musculocutaneous nerve. So really, all this is the reason I want you to understand this is because if you understand where things are, big picture, you'll kind of be able to understand everything else. If you know the median nerve is not going in the back of the arm, you're never going to guess that the triceps are innervated by the median nerve. The median nerve never goes back there. The only nerve that goes back there is way back there. Radial nerve. And what's the other nerve that's behind the posterior behind the medial intermuscular septum? What other nerve is behind the medial intermuscular septum? Medial intermuscular septum's here. What other nerve runs behind that? Ulnar nerve, right? So the only things that can be innervated by, the only muscles in the back that can be innervated by anything have to be innervated by either radial nerve or ulnar nerve, okay? Because they're back there. So ulnar nerve is a much better guess than median nerve. Still not a good guess or correct, but at least you're thinking about where the things are. That's kind of where we're starting. Safest position in the arm. Oh, this is bad, poorly written. Safest position to put the arm in when cutting the subscap. What do you want to do? What nerve might be in danger there? Axillary nerve, okay. So how would you get that axillary nerve out of the way? You adduct, you abduct, what do you do? Externally rotate, internally rotate. It's a little bit tricky. The axillary nerve is, we said it stays really close to what other bony structure? Right underneath the glenoid. Okay, so how can you get the subscap away from the glenoid? From a rotation perspective. How do you get the insertion of subscap away from the glenoid? You want to internally rotate or externally rotate? We got one vote for internal, one vote for external. So it's here, subscap insertion is here. You want to get that further that way, right? So what do you do with the humerus? Externally rotate, okay? That takes that further away. And then adduction and abduction is all about keeping tension off of that axillary nerve. That axillary nerve is a little bit lower, subscap is a little higher. So if you abduct, it's going to pull it up. Okay, if you adduct, it's going to let it hang down. So you adduct it and externally rotate it. So there's axillary nerve, runs right there. So you keep it adducted, okay, so that it's not, you can imagine if you're abducting it, it's going to get pulled up here, right? You keep it adducted, that keeps it down low here. And then you externally rotate it to bring it away, to bring the subscap insertion away from that axillary nerve. All right. Oh, here's a good one. Performing surgery in the beach chair position, assistant places excess traction on the humerus while the head is fixed in the head holder. This is likely to result in numbness where? So this is a three-part question, okay? The first part is, so what does the mechanism of injury look like here? What is this person, they're pulling here while their head is held here. So what is that going to do? Traction on, okay, so traction like this, right? So that's going to stretch what portion of the brachial plexus? Superior, middle, or inferior? Superior, okay? So that's the next part of this question. It's going to put traction on the superior part of brachial plexus. What nerve is superior in the brachial plexus? Musculocutaneous, nice, good job. So that's going to result in numbness where? It's actually a four-part question. All right, so where is the sensory innervation for musculocutaneous nerve? Getting pointing here. We went over this before. What is its most distal function? Sensation. Where does it do sensation? Musculocutaneous nerve. It's getting a long ways away from the shoulder, isn't it? I'd ask you to study the anatomy of the arm. Turns out it's all connected. So musculocutaneous nerve does sensation where? sensation brachioradialis. It's not a terrible guess because it kind of is along that same distribution. So the most distal function of musculocutaneous nerve is sensation here in the forearm, which is the lateral antebrachiocutaneous nerve of the forearm. That's the most distal function. LABC, musculocutaneous nerve. Okay. So the correct answer is radial aspect of the forearm. So there it is up top. Musculocutaneous nerve way up top. So we figure that out. And then you just have to know what it's doing from there. And you have to know that musculocutaneous nerve has a sensory distribution. And when we do biceps tendon surgery, we always are messing with that nerve. You're going to get to see it if you do biceps with me, because I always find it. All right, big picture. What three muscles provide the majority of power for motion in the shoulder? It's an easy one. Big muscles. Deltoid, pec major, and lat, right? Yeah, that's it. There's another big muscle on here. Well, they're actually all pretty big. Subscap is huge. Subscap is like an inch thick. But serratus anterior is also really thick, big, thick muscle. And there's that cool picture again, right? So serratus anterior is paralysis of serratus anterior is responsible for what? Scapular wing, lateral, medial. Medial scapular winging. Any guesses for lateral scapular winging?
Can you repeat the question?
The question is serratus anterior, paralysis of serratus anterior is responsible for scapular winging. Is it medial or lateral scapular winging? Okay, we'll leave that one. You guys can come back to that one. So you can report back to me on scapular winging. Medial. Got medial scapular winging. Right. All right. Excessive traction on coracobrachialis results in weakness with what function? You guys better get this. Coracobrachialis, what nerve lies right near coracobrachialis? Musculocutaneous nerve, which is going to lead to weakness in what function? Elbow flexion. What else? What other, not another nerve, but same nerve. Weakness in that nerve causes weakness in what function? Supination, right? Because that all those biceps are inserting where? By the elbow. On the radial tuberosity, okay? Down by the elbow. And the radial tuberosity is not, it's eccentrically placed on the radius. It's not in the center of the radius. Can't be really, this rotates, right? So it's rotating the radius because it's placed on an awkward position on it. It's very smart, but it's awkward. All right, so that's going to be elbow flexion. Internervous plane for the anterior approach to the shoulder lies between which two muscles? God, it's like a super softball. Delton pec major, right? We've already gone over that. Keep moving. Cephalic vein drains into which vein after it passes through the clavipectoral fascia? What vein is right there? It's the same veins that there's the arteries, right? We went over the artery. And what are the veins? Sort of the same. Axillary. So that's axillary vein, right? Starts off as subclavian artery, subclavian vein, axillary artery, axillary vein. And then goes to cephalic, which is a branch off of, or branch to, right? There's that picture there. See how that works? So here's the big guys. They stick down here. All right. And the arterial branches off of this. are going to be the anterior and posterior humeral circumflexes, right? The venous branches are coming back. I think this is wrong. I think this is probably these vessels here probably, there's probably are vessels in the back there, but there's also certainly vessels coming from the front there. Venous vessels. We're not talking about arterial stuff here. Because we know the arterial stuff is going anterior and posterior to the humeral head to get up to do the vascular supplies for the humeral head, right? All right. What is the excursion of the biceps tendon? How much does that thing move? Up to 6 centimeters. One guess for 6 centimeters. Any other guesses? 4, 6. It's probably not 2, right? Because your humerus has got to move a lot. It's probably not 10. So I think 4 and 6 are probably pretty reasonable estimates, and it's going to be different for different people. Point is that biceps has got a lot of excursion. Long head of the biceps, right? Not short head. Those don't have nearly the excursion. So excursion is all about motion. Okay. Tendons that have a lot of excursion can move a joint a long ways. Tendons that don't have a lot of excursion typically are powerful, but they can't move things as far. Okay. Does that make sense? So, for example, brachioradialis has almost no excursion, right? That muscle it's got a huge origin and a huge insertion. It doesn't get a lot longer, it doesn't get a lot shorter, but it's pretty strong. It's a powerful muscle, but it's in an awkward position. So it's only powerful through very small range of motion. When it's in an optimal position, it's super strong. When it's in a bad position, it's not. Your finger flexors, those guys have a ton of excursion, but they can't generate a ton of power. So anything that has a lot of excursion has more difficulty generating a lot of power. Things that have less excursion are better at generating power, but they can't move things through quite as far of a range of motion. That's why for your shoulder, you've got to have muscles that are sort of doing both things. You've got some more excursion and ones that have less excursion. Does that make sense? We did this, so I'm not going to do this again. See if you guys learned anything. For board is a quadrangular space. So what runs through the quadrangular space first? That's that superior space, right? What runs through there? Axillary nerve, posterior circumflex humeral arteries, medial border, long head of the triceps, right? Lateral border, humeral shaft, superior border, teres minor, yep, and inferior border, teres major, right? And that's easy now because we can picture how those things go together. Just put that in your brain forever, you'll be fine. Good. There it is again. Teres minor up top, long head of the triceps, humeral shaft, teres major down there. Teres major inserts between latissimus minor, latissimus dorsi inserts between which two muscles? Teres major and pec major, right? Teres major is going around there, latissimus dorsi is coming in between there. Nerve that innervates the triceps runs between which two muscles? So which nerve innervates the triceps? Radial nerve, and where does it run between? Lateral and long head. One guess for lateral and long head. Lateral head. Oh, this is kind of, there's lateral and long head. Just going to show you the picture here. It's better. So that radial nerve is always very close to bone. That's why it's always in such danger. Radial nerve just it doesn't take a joke. Okay. So lateral head of the triceps is here, medial head of the triceps is here, and that nerve is running right in between the two of them. So between the lateral head and the medial head, and the long head is further away, quite a bit further away, especially up top. Down low, of course, it's right there all together. Does that make sense? See how those guys are all right there? Oh,
It's 8:30, just so you know.
okay. So which structure passes through the internervous plane formed by two muscles innervated by the suprascapular and subscapular nerves? Yeah, that's a multi-thought question, right? So let's think about it for a second. Two muscles innervated by suprascapular and subscapular nerves. So which of the nerves, what are the muscles innervated by suprascapular nerve? Supraspinatus and infraspinatus, okay. And what what muscles innervated by subscapular nerve? Subscapularis. What structure passes between those? So it's not going to be between infraspinatus and subscapularis, right? We know that. So it's got to be supraspinatus and subscapularis. So if you say supraspinatus and subscapularis, what do we, the space between those two muscles, what do we call that space? That interval. The rotator interval, right? Okay. So what structure passes through the rotator interval? And these used to be multiple choice questions, but I took away the choices because questions like this, it really makes you think about it more. If you think about what structure passes through the rotator interval? Biceps tendon. Nice. It's not a hard question, but it makes you think about it a little bit, right? There it is right there. Subscap. Supra. I mean, it's clear as day. It's right there. It's very easy. All right, we know this. You guys know the answer to this question. What structure will help you identify the internervous plane for the anterior approach to the shoulder? It's phallic vein, all right? It's the first thing you're gonna find. Bam. That's what it looks like. It never looks quite that clear. Only muscle that both flexes and extends the humerus. Deltoid. So it's got to be a big muscle. It's got to be able to insert on the front and on the back of the humerus, basically, right? The two heads of pec major. Clavicular head. Sternal head. What's the third origin of that muscle? We looked at it on one of the earliest slides. Abdominal fascia. No, definitely not. Abdominal fascia. That closer. Where else does it originate? Where does pec minor originate? That's where it inserts. Sternal head, clavicular head, and ribs. Yeah, so it's way up there, which makes sense, right? It's sternum and then it's just sweeping down below that. Lateral approach to the shoulder, what limits the distal extending incision, how far can it be found from the tip of the acromion? So lateral approach to the shoulder here, coming in here. So for example, open cuff, you're doing an open cuff. Axillary nerve is coming around there. And how far distal from the tip of the acromion? So how far distal here? 5 centimeters is a pretty good, I usually say 6 centimeters, but it's 5 to 7 centimeters. Different people, different size. You may see that. Usually people just avoid it. This will be our last question because I've got to go to clinic. Kim is probably on the other side of this thing going, Dorf, you need to hurry up. So triceps has 3 origins. What are they? Let's start with long head. We know where that originates. Where is that? Okay, on the inferior glenoid, basically inferior glenoid tubercle. When we looked at these guys, right, we looked at that medial head and the lateral head. Where are they originating on? It's on the humerus. Okay, so where? It's not that complicated. Lateral head of the triceps. Say it. What do you got? How about posterior lateral humerus? Yeah. No, it's pretty simple. Medial head, posterior medial proximal humeral shaft. And lateral head is posterior lateral humeral shaft right there. It does those two guys. And what nerve is running between them? Radial nerve. What other nerve lies in the posterior compartment of the humerus? Ulnar nerve. It's not way back here, right? It's running right more back here, but it's posterior. All right, I gotta go. That's too bad. This is fun. Thank you all for joining remotely. You definitely had a better show remotely than you had if you were here. Certainly a lot less pressure. Hopefully you got something out of this. Hopefully you got a few questions right. Hopefully you got a few questions wrong. You guys are going to come back to me with a very short 1-paragraph summary of scapular winging, the two nerves that are affected in scapular winging and the muscles that are affected in scapular winging and what it causes. Oh, and also the age groups, lateral and medial scapular winging, different age groups.